You might think you know the major health challenges in livestock,
Hmm.
right? But sometimes, well, the biggest problems come from what seems like the smallest player.
Mm.
What if a common bacterium could quietly set the stage for much more devastating diseases? Kind of like an unseen architect behind this cascade of issues impacting an entire industry.
Yeah, that's a good way to put it.
Today, we're taking a deep dive into Bordetella bronchiseptica in pigs. And this isn't just about a sniffle. It's really a masterclass in how one uh, seemingly minor pathogen can become a major strategic player in a herd's health.
Exactly.
Our mission is to unpack the fascinating, sometimes pretty insidious ways this bacterium operates, its surprising impact, and the sophisticated strategies developed to manage it. We've got a stack of research here, pathogenesis, clinical effects, control methods, and we're going to pull out the key nuggets for you.
And what's truly fascinating here, I think, is its dual identity. Bordetella bronchiseptica is, well, it's everywhere. It's ubiquitous and highly infectious, and it can cause a condition called non-progressive atrophic rhinitis all on its own. But its most critical role, the one that really grabs our attention in modern swine production, is as this crucial predisposing agent.
Oh.
Think of it like the advanced scout that weakens the defenses. It allows much more severe infections to take hold, making it a pathogen of immense economic and, frankly, welfare importance globally.
Okay, so let's pull back the curtain on this microscopic strategist then. At its core, Bordetella bronchiseptica. It's a gram-negative bacterium, lives mainly in the upper respiratory tract of pigs.
That's the basics.
But that simple description, it sounds like it hides a lot of complexity. So what's its signature move, and how does that seemingly mild impact set the stage for something, much worse?
Its signature move, as you put it, is really a two-step process. First, yeah, it's the primary direct cause of non-progressive atrophic rhinitis, NPAR,
MPR.
which is generally, a pretty mild condition on its own. But the truly significant role, particularly in today's swine operations, is its work as a predisposing agent.
Right, that weakening role you mentioned.
Exactly. Essentially clears the way. It creates the necessary conditions for other, often more virulent pathogens like toxigenic Pasteurella multocida to cause the far more severe progressive atrophic rhinitis, or PAR.
FER. That sounds worse.
It is much worse. And if we look at the bigger picture of pig health, Bordetella is a key player in the porcine respiratory disease complex, PRDC.
The PRDC. Yeah, we hear a lot about that.
It's kind of a rogues gallery of diseases that collectively cause massive problems. So while Bordetella might seem like a minor pathogen when it's acting alone, its ability to just hang around, persist, and compromise the pig's frontline defenses, that's precisely what makes it so impactful.
It's a powerful image, an advanced scout weakening the lines. So if Bordetella is this master strategist, how does it actually breach the pig's defenses? How does it cause this damage? What are its tricks, especially with these virulence factors and toxins we read about?
Well, it's highly adapted. Its target is the ciliated epithelial cells, those tiny hair-like structures lining the respiratory tract. Okay. It produces these tiny molecular grappling hooks, essentially. They're called adhesins. Helps it attach really firmly.
Right, so it gets a good grip.
Exactly. And then it unleashes a whole arsenal of toxins. One of the main ones is the dermonocrotic toxin, or DNT.
DNT.
And this is where it gets really insidious. DNT doesn't just damage cells, it actually messes with bone remodeling.
It affects the bone. How?
Yeah, imagine this tiny bacterium not just making a pig sneeze, but actively disassembling the little bones inside its nose, the bony trabeculae of the nasal turbinates.
Wow.
And then it causes them to be replaced with weaker fibrous tissue. That's the subtle genius of DNT. It leads to that mild atrophy you see in NPAR.
Okay, that's fascinating.
And then there are other toxins like tracheal cytotoxin and adenylate cyclotoxin. They basically gum up the works of the pig's natural conveyor belt system.
A mucus clearing thing.
Exactly, the mucociliary clearance mechanism. It's vital for sweeping out dust and germs. So Bordetella damages that.
So it breaks down the physical barrier in the cleaning system?
Precisely.
Yeah.
This initial damage is critical. It disrupts the physical barrier, severely impairs local immune defenses, and leaves the pig wide open to secondary invaders.
Which brings us back to Pasteurella.
The synergy with Pasteurella multocida is a prime example.
Yeah.
See, P. multocida doesn't stick well to healthy tissue, but the damage caused by Bordetella gives it the perfect foothold, and that leads to severe, often irreversible bone loss in PAR. The DNT from Bordetella and the Pasteurella multocida toxin, PMT, they act together for the most destructive
A
lesions.
nasty combination.
Truly. And it's not just Pasteurella. Bordetella also makes things worse with viral diseases like PRRSV and swine influenza virus, SIV, and other bacterial infections too. It just makes the whole situation more complex.
Okay, so Bordetella is a master of entry and setting the stage for bigger problems. Given this impact, how does a pathogen this cunning actually spread through a whole pig herd? What are the common pathways?
Well, it's highly contagious, unfortunately, very easily spread.
I bet.
The primary reservoir is the carrier sow. She might not even look sick, but she can transmit the bacterium to her piglets.
How?
Through direct nose-to-nose contact and also through tiny airborne droplets, aerosols, very shortly after birth.
Right for the start, then.
Exactly. And once it's in a group of young pigs, weaners and growers, horizontal transmission is incredibly rapid, especially when pigs are mixed or moved around.
Makes sense. Stressful times for them.
Very. And the kicker here is that pigs can stay colonized, meaning they carry the bacteria and shed it for a long time. They act as these persistent, often unnoticed sources of infection within the herd.
Wow, so they can look healthy but still be spreading it.
That's often the case, yeah.
Okay, so beyond that direct transmission, what factors in a pig's environment or maybe management practices make them more vulnerable or make the disease worse? Are there specific conditions that kind of roll out the red carpet for Bordetella?
Oh, absolutely. The severity of the disease is strongly influenced by the living conditions.
Like what specifically?
Well, think about that red carpet. Overcrowding is a big one. Increases stress, increases nose-to-nose contact.
Right.
Poor ventilation is another major culprit. If the air quality is bad, with high levels of irritating gases like ammonia or lots of dust, that directly compromises the pig's respiratory defenses, makes it easier for Bordetella to get in and cause trouble.
So clean air is crucial.
Absolutely. And then there are continuous flow housing systems, where facilities aren't fully emptied and disinfected between groups of pigs.
Yeah, I know the type.
Those are a huge problem. They basically allow the pathogen to constantly cycle through the population. It never really gets cleaned out.
Creates a reservoir.
Exactly. These factors don't just help transmission. They actively wear down the pig's ability to fight off the infection. And of course, if the pigs are already dealing with other diseases like PRRS or mycoplasma, that adds immense stress and significantly ramps up the overall sickness, the morbidity.
It sounds like a lot of variables have to be managed just right. So, okay, let's talk about what you actually see. If a pig has this non-progressive atrophic rhinitis, the MPAR caused by Bordetella, what are the telltale signs?
In NPAR, the signs usually pop up in young piglets, sometimes as early as 1 week old, and they're pretty common in weaners and growers, too.
Okay.
You'd probably notice persistent sneezing, maybe some snorting. A nasal discharge is common, starts clear, but can become pus-like, more purulent.
Okay, sneezing, runny nose. Sounds like a cold.
It can look like it. You might also see tear staining below their eyes. That happens because their tear ducts can get blocked or inflamed.
Ah, interesting.
But here's the crucial part. While you might see a mild twisting of the snout, you don't see the severe permanent facial deformities that you'd associate with the more aggressive PAR.
So MPR is less severe visually.
Definitely. And in fact, that turbinate bone damage in MPAR, it can actually regenerate over time if the pig recovers.
Oh, really? That's hopeful.
It is. Now, it's worth noting, Bordetella can also cause primary bronchopneumonia, especially in very young pigs.
Pneumonia, so lower down in the lungs.
Exactly. And here, the signs are more severe. You're looking at a persistent, hacking kind of cough, fever. The pigs go off their feed, lose condition.
That sounds much more serious.
It is. In the most severe outbreaks of Bordetella pneumonia, mortality can actually be quite significant.
Okay, that visual distinction between MPAR and potential pneumonia, or PAR, sounds critical. So once a vet observes these signs, how do they move from just suspicion to actually confirming it?
Right.
What are the diagnostic tools?
Well, a presumptive diagnosis can often be made just based on those clinical signs and the age of the pigs affected.
Right.
But laboratory confirmation is really necessary because, as you said, the signs can overlap with other respiratory diseases.
So a test do they run?
Common tools include bacterial culture from nasal swabs. We take a swab, try to grow the bacteria in the lab. We also use PCR polymerase chain reaction. It's a very sensitive test that looks for Bordetella DNA directly in the sample.
More direct detection.
Exactly. And then there's histopathology. That means examining tissue samples, usually from the nasal cavity, under a microscope. We look for those telltale signs like inflammation of the lining, the mucosa, and damage or loss of those cilia we talked about.
Checking for the actual damage it causes.
Precisely. And this brings up a really critical point for anyone managing pigs. Why is it so vital to differentiate NPAR from the much more severe progressive atrophic rhinitis?
Why?
Because making that distinction immediately tells us whether we need to specifically investigate and rule out the presence of toxigenic Pasteurella multocida, and that completely changes the game plan for control and treatment.
Right, because the Pasteurella makes it PAR, the really bad one.
Correct.
Okay, so we've outlined its sneaky nature, how it works, how it spreads, how to spot it. What does this all mean for actually managing the disease in a herd? It definitely sounds like there's no single magic bullet here, more like a complex puzzle.
Exactly right. You've hit on a critical point. Effective control of Bordetella bronchiseptica truly requires a multifaceted, integrated approach. If we think about livestock health generally, it's rarely about one silver bullet solution.
Yeah, it's usually a combination of things.
It really is. It's about combining robust environmental management, smart vaccination strategies, and judicious strategic medication, putting all the pieces together.
Okay, let's break that down. Starting with where the pigs live. What management strategies, specifically around housing and environment, can make a real difference?
Improving husbandry and housing conditions is absolutely foundational. Think about designing a living space that actively discourages bacteria.
How do you do that?
Well, proper ventilation is key. Constantly refreshing the air, reducing those airborne bacteria levels, getting rid of irritating gases like ammonia.
Okay, air quality number one.
Definitely. Then reducing stocking density.
No.
Fewer pigs packed together means less stress, fewer opportunities for nose-to-nose transmission.
Makes sense.
And crucially, implementing all-in, all-out systems. AIAO.
AIAO.
Right.
This is where you move groups of pigs through facilities together. And then the really important part. The facility is completely emptied, thoroughly cleaned, and disinfected between batches.
Breaks the cycle.
It breaks that cycle of infection,
Right.
stops the pathogen from just building up in the environment, and of course, strict hygiene across the board for people, equipment, everything is essential.
So really good housekeeping is fundamental.
Couldn't put it better myself.
Okay, how does vaccination fit into this integrated strategy? Especially thinking about the sows and those very young, vulnerable piglets.
Vaccination is a vital shield in our arsenal, really key. The primary strategy usually involves vaccinating the sows before they farrow, before they give birth.
Why the sows?
Because vaccinating the sow stimulates her immune system to produce antibodies. These antibodies then get concentrated in her colostrum, that crucial first milk.
Passing immunity to the piglets.
Exactly. It provides passive immunity, gives those vulnerable newborns protection during their most susceptible first few weeks of life. What about vaccinating the piglets directly?
That's also done, especially in herds where there's high disease pressure. You can directly vaccinate the piglets themselves. This stimulates their own active immunity, sort of picking up as that maternal protection naturally starts to fade after a few weeks.
So a two-pronged vaccination approach sometimes.
Can be very effective, yes.
Now, given to bacterial infection, I imagine a lot of listeners are thinking, what about antibiotics? Can they just cure the infection? What are the limitations there?
Yeah, that's a common and very understandable first thought. And while antibiotics, things like tetracyclines or sulfonamides, can certainly treat the clinical signs.
To make the pigs feel better.
Right. They can reduce the sneezing, the discharge, the severity of symptoms, but their effectiveness in completely eliminating the carrier state, getting rid of the bacteria entirely from the pig, that's actually quite limited.
Oh, so they don't fully clear it?
Often not. And here's the tricky part. Treated animals, even though they might look perfectly healthy after treatment, can, and often do, continue to shed the bacteria.
So they can still infect others.
They can still be a silent source of infection, which also ties into the whole global push towards reducing reliance on antibiotics in livestock production,
Right, antibiotic stewardship.
Exactly.
Okay.
It really underscores how important prevention is through that good management and robust vaccination we just talked about. Strategic medication can be used, but it's typically aimed more at limiting colonization during specific high-risk periods, like weaning. It's not really a standalone cure-all.
That's a really important nuance. Okay, so it's about much more than just treating symptoms when they appear, beyond what happens inside the farm gates. What about broader biosecurity? How do you stop Bordetella from getting introduced in the first place or spreading between farms?
Biosecurity. That's the outer wall of defense, you could say. Absolutely critical.
What does that involve practically?
Well, it starts with being meticulous about where you source new animals, only bringing in pigs from herds with a known clean health
Know
status.
your source.
Definitely. Then, quarantining any incoming animals, keeping them separate for at least 30 days before they join the main herd. Gives you time to observe them, maybe test them, make sure they aren't bringing anything unwelcome with them.
Like an isolation period.
Precisely. And it's also about controlling vectors, things that could physically carry the bacteria onto the farm. Wild birds, cats, rodents,
Things you might not think of immediately.
prey. And then strict hygiene protocols for absolutely everyone and everything moving onto or between different areas of the farm. People, boots, coveralls, equipment. It all needs managing to prevent mechanical spread.
Sounds like a lot of attention to detail.
It is. You really have to think like the pathogen, anticipate how it might try to get in or move around.
Okay, we've covered a lot of ground here.
We have. And I think we've seen that Bordetella bronchiseptica is really far more than just the simple cause of rhinitis, isn't it?
Definitely not just a sniffle.
No. It's a subtle but profoundly significant player in swine health. It acts both as that primary pathogen causing MPAR, but crucially as that strategic predisposing agent, the one that amplifies the severity of the whole porcine respiratory disease complex.
That facilitator role seems key.
It really is. Its unique ability to compromise those respiratory defenses and then synergize with other dangerous agents. That's what makes it such an economically important target. And ultimately, effective management, it truly requires that integrated proactive approach we talked about, combining robust vaccination, diligent environmental management, and really stringent biosecurity. There's no single fix.
So, stepping back, what does this deep dive into Bordetella bronchiseptica tell us about the broader challenges of managing health in complex systems, whether it's, a pig herd or maybe even a business or any complex environment?
That's a good question.
Perhaps it's that the minor issues, the ones that seem like just a sniffle, right? If you leave them unaddressed, they can become the unseen architects of much larger, more costly, maybe even devastating problems down the line.
That's a very insightful point. The small things can have big ripple effects.
Yeah, it feels like a powerful reminder that truly understanding any system means appreciating the interconnectedness of all its parts, even the ones that don't immediately seem like the main event. So maybe a thought for you listening. What seemingly small factors in your own field, your own interests, might be quietly setting the stage for bigger outcomes, just waiting to be uncovered.